Well, it's my great privilege to introduce Beth Macy tonight, and I'm delighted to see this crowd. It's a fantastic crowd, and it's an important book, and it's an important topic. So thank you very much for coming. Beth Macy is a Roanoke, Virginia-based author, and she has, to her credit, 3 New York Times bestsellers in the nonfiction category. Her 20 prize-winning Factory Man, How One Furniture Maker Battled Offshoring, Stayed Local, and Helped Save an American Town, is a remarkable story. It's the story of the Bassett Furniture family of Southern Virginia, sort of along the Highway 58 corridor, and what they did to grow that region, and then what one of them and some of his colleagues tried to do to keep the furniture industry going in that region. The story that it foreshadows is one that ultimately wound up creating some situations that we're going to hear about later tonight. One where the factories left, and then there was long-standing poverty and some loss of social capital and some loss of personal wealth and well-being, and that sort of created tinder that ignited into the opioid epidemic later on. I suspect that we'll hear Beth's insights about that. Her 2016 book, True Vine, Two Brothers, A Kidnapping and a Mother's Quest, was a Kirkus Prize finalist and was longlisted for the Carnegie Prize. It's the story of George and Willie Muse, 2 African-American brothers who were kidnapped and used as a sideshow in a circus, and whose mother embarked on an epic, decades-long battle to get them back and to get justice for her family. Both of those 2 books are in development for film. Her exploration of the opioid crisis, which is called Dopesick, Dealers, Doctors, and the Drug Company That Addicted America, was published August 7th, and it entered the New York Times bestseller list that week at number 6. You may have heard Beth speak about this book on the Today Show, Fresh Air, tomorrow morning on CNN. You may have read one of the rave reviews in the New York Times, Washington Post, or the Wall Street Journal, or virtually every other publication that covers such work. Within this book, you'll read some familiar names. You'll hear about Doctors Sarah and Hughes Melton, for example. You'll hear about Dr. Stephen Lloyd, who happens to be sitting right there. You'll hear about Dr. Art Van Zee. Is Art here tonight? Is Art Van Zee here? Okay, that's too bad. And you'll hear about Bob Garrett and about his efforts to create good housing for folks in recovery. And you'll hear about our prescription drug abuse working group from ETSU and what we're trying to do in the region. And more specifically, it's a story about the region. The political boundaries that we feel just to the north of us and to the east of us are artificial. This is a region, and our people are of this region, and so we feel these situations acutely across these borders. Beth earned her bachelor's in journalism at Bowling Green State University and her master's in creative writing at Hollins College, and she was a Neiman Fellow at Harvard in 2010. Bear with me for one more second, and we'll get to the real talent tonight. I came to know Beth when a mutual acquaintance of ours connected us in 2016 when Beth was researching her book. As director of the Center for Prescription Drug Abuse, I give a lot of talks, and I had given a talk, and this person heard it and said, "Hey, you need to meet Beth." And when I did, I was immediately struck by 3 things. The first was the depth of her intellect. She came to our meeting as an expert on this epidemic already. She had done her homework all the way. And she knew all about the drivers of the epidemic and what was going on and what the consequences were. The second was her gift for listening closely and with a journalist's ear, and then making connections between details and people's stories. That's amazing because she takes the facts and then marries them to something that is very compelling, and I think that's a real gift. And finally, I was struck by the depth of her compassion. this was clearly a mission for Beth, and many of us are in this room attending to this very serious epidemic because of a personal mission, and it's very clear that that's the case for Beth. And so she has had friends and family that were personally touched by the epidemic, and it's going to come through, I think, in the passion with which she speaks about the topic. So I'm privileged to say that along the way, I came to know Beth as a friend, in addition to being a colleague, and I often will just get a quick text or a note of encouragement from Beth, and it's just been a real privilege to get to know her. I'm delighted that the crowd is packed, the room is packed, and I would ask that since we have some people standing along the sides, that if you can, begin to move into the center of the aisle that you're on, and create some extra room if possible. So thank you very much, and please join me in welcoming Beth Macy.
I really appreciate you all turning out for this. I know some of you in the room, as Rob said. I like to start, this is probably the 10th or 12th talk I've given since the book came out, and I like to start by just acknowledging that I'm sure there are people in the room who have lost friends or family members to this disease, and I'm sorry. I want to thank Rob in particular, who spent many hours helping me with this book, explaining the working group he helped put together, sending me public health articles. He proofread the book for inaccuracies. He gave me 4, 5, 6 telephone interviews. About a week before the book came out, when you write a book, the publisher wants you to publish big because they want to sell that book and make the money back that they gave you to write the book. And so I was writing a piece for the New York Times about this woman that I'm going to talk a bit later about, named Tess Henry. And I had run all of my statistics by this Harvard professor who had done this research that I'm also going to be talking about in a minute. And I thought that was good enough. Harvard professor, he did the study, but not the New York Times fact checker. So like 5 minutes before I was due to speak at Remote Area Medical in Wise, I get a call from the fact checker at the New York Times. We need the specific source of this opioid statistic. And like literally I was in a panic attack. And I thought, who could find this? Because the guy at Harvard was on vacation in Spain or something. I called Rob, and he says he finds a 2,300 page document. He says on page 1573, you're welcome, is the citation for that fact. Whew, thank you, Rob. You really were great. I also want to shout out to Sarah Melton. Before I had even written the book proposal, a friend of mine, Molly Odell, who had been the health department director in Roanoke, said, you've got to call Sarah Melton. She's trained like thousands of people on how to give Narcan, and she knows the whole story. And so I called and I said, look, I haven't even written a book proposal yet, but can you let me pick your brain? And she said, sure. And we were on the phone for about an hour. And she said, the first thing she said was, you don't have enough for a book here. You have enough for 3 books. So I really appreciate Sarah and her husband, Dr. Hughes Melton. Sarah really walked me through the whole story from the very beginning to the end. And when I go back and look at the first interview I did with Sarah, it was all right there, and you knew the whole thing. And it's just such a gift that you meet people that are willing to trust you and open up and share their expertise, because I'm only ever as good as the people I'm talking to and what they're telling me. So Dopesick is it's a look at the opioid epidemic as I witnessed it landing over 2 decades in 3 different Virginia communities that I believe represent the arc of the epidemic, from distressed rural communities in Appalachia, and I focus on St. Charles, Virginia, and Lee County, to cities and suburbs. I've been reporting from Roanoke for 30 years, so that's my second place that I write about, and then more recently to kind of pristine, or what once were pristine, farm towns. I tell the stories by getting close to the families and first responders who are fighting back, A friend of mine, Roland Lazenby, he writes sports books. He quoted Mr. Rogers to me because he could tell that this book was really going to hurt me. And he said, find the helpers. So that's what I did. The big picture, as I see it, the opioid epidemic is festering and growing. It has taken advantage of longstanding fissures in American society. The fundamental philosophical differences between law enforcement and medicine, between punishing the addicted or getting them treatment for their substance use disorder. I'm not a numbers girl, as Rob can attest, but here's some numbers that just sort of blew me away, and I'm just going to read the top and the bottom one to you. But this number really put it in focus for me, and thank you, Rob, again. This was a colleague of his at University of Pittsburgh. Drug overdose has already overtaken the lives of 300,000 Americans in the last 15 years, and experts now predict that many more will die in just the next 5. So it's a line that looks like this. And that really cemented it in a sentence for me, the growth of this. Addiction is a chronic relapsing disease. It takes 4 to 5 treatment episodes over an average of 8 years for a person with opioid use disorder just to get 1 year of sobriety. That really blew me away. And as we all know, in the era of fentanyl, a lot of people don't have 8 years. So this is my first book, Factory Man, came out in 2014, about the aftermath of globalization in Martinsville and Henry County. It was a story I first started reporting when I was writing about the recession and the aftermath of the recession. I was still a Roanoke Times reporter. And so when I went down to start to write that book, I got close to the people on the ground, as I always do. I do that first. And what the aftermath of globalization looked like to me was a tripling of food stamps. This is in the county that had the highest unemployment rate in Virginia for over a decade. Disability rates went up 64% since China joined the WTO in 2001. Drug crime skyrocketing, especially heroin and meth. And one of the stories I write about in Factory Man was an unemployed guy who was stealing copper wiring out of an abandoned furniture plant. And I wrongly thought he was doing it out of financial desperation. Only later, much later, after the book was out, did I learn that he was actually doing it out of desperation, but really his motivation was to stave off being dopesick. So dopesick is what users call excruciating feelings of withdrawal. They all say, almost to a person, it's like the worst flu times 100. Diarrhea, sweats, vomiting, restless leg, it's terrible. And as one person early on in Dopesick says, at the end of your journey, you're not doing it to get high, you're just doing it to avoid being dopesick. So in 2015, according to the CDC, more opioids were prescribed per person in the US in Martinsville, Virginia, which is largely the setting of Factory Man. It's nearby Bassett in Henry County. The second highest rate was in Norton in the coalfields in Virginia. And the fourth was in Galax, which is the cover of this book. So when you talk about these twin things happening, job losses and pain as a vital sign, and opioid overprescribing, these things definitely help light the fire of the opioid epidemic. But the media was slow to put the story together, myself included. It's a given now that opioid prescribing and heroin addiction go hand in hand, but just a few years ago, it largely wasn't. I remember Sarah breaking it down for me the first phone call I made. I didn't understand that OxyContin and heroin were basically chemical cousins. They're both based on the morphine molecule. This is back in 2015. So there's a wide gap in knowledge, and that was a big part of my challenge in writing this book. I had to tell a truthful story, I had to make people care, but I was also dealing with half of a nation that knows a lot about this epidemic and half that knows nothing at all and really thinks, I'm not gonna be affected by that. And I argue in the book that because of the epidemic initially took root in places like Central Appalachia, in politically unimportant places, in distressed communities, it was allowed to fester and grow unchecked. Now, my first experience writing about opioids, in 2012, there was a kid from a wealthy suburb called Hidden Valley outside of Roanoke, where I live, who was about to go to prison for 5 years for his role in his former private school classmate's death. And when I wrote a 3-part series called The Damage Done, it was about this heroin landing in our upper middle class suburbs. People literally like spit their coffee out while they're reading their newspaper, and they went, "What? Wealthy white kids are doing heroin?" They had no idea. So much separated Spencer, and that's him in his jailhouse mugshot, from the guy who had been stealing the copper wire out of the Bassett factory plant. But if you look at their mugshots, they look almost identical, down to the methamphetamine scratches on their face. So Spencer allowed me to follow him as he was getting ready to, he was going through drug court and he was getting ready to go to prison. The judge gave him time to really do a good drug court program. And he had gotten started with opioids the same way 3/4 of heroin users do, by taking prescribed medications. In this case, he stole them from his mother's medicine cabinet. They were left over from the surgery. So if you take nothing else home from this, and I know you all are public health people and you don't have any opioids in your medicine cabinet, but check, just in case. And I told the story through their mothers largely. And actually, at the end of the book, I update you on Spencer. I was able to talk to him after he got out of prison, where he developed a terrible case of PTSD, and he now has a service dog, and that's him with his dog. During the interim, after the stories ran in 2012, I wasn't yet a book writer. I didn't know I was going to be writing a book on heroin or anything else at that point, but I just kept in touch with the mothers because that's what I do. I keep in touch with people that I get to know through my stories. I spend a lot of time with them. I like them. And what I noticed with Ginger in particular, as I would call her, she said, "Beth, you wouldn't believe it. People are driving from 3 hours away to see me because you wrote about me on the front page of the newspaper." And these were parents. One was a preacher from Pulaski. He and his wife drove, and they would go to her jewelry store. She owns a chain of jewelry stores in Roanoke. She's quite well known. Her pictures are in her ads and stuff. And they would pretend to shop, but she learned to spot them. They would shop for a little bit, but they weren't interested in gold. They would eventually come up to her and ask her, "What do I do? My son is addicted, or my daughter is addicted." And what I started to notice that in the wealthier suburbs, so the first time heroin really makes the news in Hidden Valley, so aptly named, these 2 weathermen get caught. They overdose, the police are called, it becomes a big story. This is 2006. By 2010, when Spencer and the other young man are sort of outed by the newspaper, people erroneously thought that they were outliers. They thought, well, Spencer's going to jail. There's that. And when I interviewed the prosecutor who helped send Spencer to prison, he said, "The first time I arrested a kid from Hidden Valley, I got his phone and there were 50 text messages of people he was dealing and selling to." He said, "That kept me up at night." He knew as early as 2006 that this was really going to be a thing. In the wealthier suburbs, I argued, the kids could hide it longer. They could tell their moms their iPads were stolen rather than pawned for drugs, or take jobs with senior moving companies, as one kid in the book did, with the express intent of stealing pills. And many of the kids I write about in the book were in the same peer group as Scott and Spencer and Ginger's son. One of the moms told me it was like a Dementor from Harry Potter descended upon Hidden Valley and said, "I want you, I want you, I want you." So here's the first doctor in America that I could find to actually pick up the phone and call Purdue Pharma in the late 1990s. OxyContin came out in 1996. And by 97 and 98, it was already appearing to be a crime problem in these communities in rural Appalachia. Dr. Van Zee works at a sliding scale federally qualified clinic, and it's in Virginia's westernmost point. And he's calling Purdue and he's saying, "Look, I know it says on your insert that addiction is exquisitely rare, or less than 1% of people will get addicted to this drug because of our brand new time-release mechanism. But listen, people here where I live have figured out how to do an end run around the time-release mechanism. They put the pill in their mouths, the pill would dissolve, and the coating would dissolve that had the time-release bit on it. Then they would take it out and they would crush it up and snort it or inject it. He's calling them up saying, I know you say it's not addictive, but I'm being called out in the middle of the night to the hospital to attend to an overdose of a teenager that I immunized as a baby. This drug is addictive. One of the first police officers to notice it said he noticed that people were walking around with green and orange stains on their shirts. That's the 40 milligram and the 80 milligram OxyContin. So Dr. Van Zee, who previously had had 1 or 2 or maybe 3 patients a year with drug dependence, suddenly it's like his whole practice is about that. And not just teenagers, but farmers who came and were losing everything. They lost their family, they lost their farm. One told him, it became my God. And yet the company claimed that the drug's time-release mechanism made it non-addictive. And it used old data that it had been performed in hospital settings, not outpatient, to buttress this claim. The FDA let them get away with making this squishy claim on their application that because of the brand new time-release mechanism, it was believed to reduce the liability of addiction and abuse. The FDA allowed them to make that. And then they took that little tiny squishy claim and they made it into a certainty by sending the reps out and using this old data. They pulled a letter to the editor of the New England Journal of Medicine in 1980 that wasn't meant to be used as a statement on long-term opioid use. And mostly they flipped the narrative that for 100 years we knew opioids were very dangerous and addictive and only used for severe pain, end of life, and cancer. And they said it's okay for moderate pain. It's okay for lower back pain. Who doesn't have lower back pain? It's okay for osteoarthritis, TMJ. Any type A people here like me with TMJ? Yeah, it's okay for TMJ. That prosecutor I told you about that was starting to lose sleep at night, he had a German Baptist young woman sent home with a 30-day prescription for OxyContin. He said in 2 months she was prostituting on the streets of Roanoke, a German Baptist woman. The company sent its reps into communities, an army of reps with high rates of disability like Martinsville and Henry County and St. Charles. What they did is they bought the data, the prescribing data, and they didn't, the data told them which doctors and which communities were already prescribing immediate release opioids, which would be their competitors like Vicodin, Percocet, Lortab. And those communities ended up being communities that had had large percentages of workplace injuries and legitimate pain. And the reps told the doctors using this bad data and lots of gifts that OxyContin was safer to use. They sent 5,000 nurses, pharmacists, and doctors to become paid speakers for the drug. They went to places like Florida and Arizona where they would wear an OxyContin beach hat, or they would give them, they would find out what the doctors like. If it was Cuban cigars, the reps would come toting whatever it was you wanted. Including music CDs, Christmas trees, hams, etc., while kids were overdosing in the high school library. A doctor in Bland, Virginia put up a sign-up sheet in her office so that reps could vie to sponsor her kid's upcoming 13th birthday party to Carowinds, the amusement park. And one rep, not a Purdue Pharma rep, not an opioid rep, did. So Dr. Van Zee starts writing them. My fear is that these are the sentinel areas, these being distressed communities, just as San Francisco and New York were in the early years of HIV. That just makes the hair stand up on the back of my neck. They organized, Dr. Van Zee and his wife Suella, community activists, a septuagenarian nun named Sister Beth Davies, and they fought back. They picked up parents who were losing their children in places like California and Philadelphia and Florida, whose kids had overdosed on OxyContin. And they helped federal prosecutors amass enough evidence to prove that the company had criminally misbranded the drug, but it took a decade. So think about all the addiction that had been seeded already in that time. In 2007, the top 3 company officials from Purdue were fined $34 million in Abingdon, Virginia, and the company was fined $600 million, but no one went to jail. And it would be 3 more years before Purdue did what Van Zee had been begging it to do since the first time he called them on the phone. He said, please take it off the market and reformulate it to be abuse resistant. And finally, it was reformulated in 2010, 14 years after it came out. That's Sister Beth in the left corner. She's now 86, I think. She works about 12 hours a day. She's an addiction counselor. She and Dr. Van Zee collaborate on patients, so she leads meetings and does counseling with them. He now is a buprenorphine or medication-assisted treatment doctor. He's been doing that for quite some time. This is at the sentencing hearing, which was in the rain in 2007. Mothers who had come, who had lost children, they marched in the rain. That's Ed Bish in the bottom leading a parade with OxyKills. His son Eddie was 19 when he died. He said, the first time I heard the word OxyContin, my son was dead from it. So he's an IT worker in Philadelphia. And this is early on in the days of the internet. Eddie died in 01, I think it was. And instead of starting a website, Ed started a message board, and it was called oxykills.com. And he sort of helped organize all the parents in this movement. One of the parents was a woman named Lee Nuss. Her son Randall died after taking an OxyContin. And one of the things the judge did at the trial that I found so moving was the parents were begging him to put the executives in jail. And the sentencing agreement had already been ironed out, and the judge felt like his hands were tied, and he had to go with what they had already previously negotiated with the help of Rudy Giuliani working for Purdue. But the judge did let the parents testify on the stand about the drug and what harm it had caused their families. And Lee Nuss, who's about 4'10", a little smaller than Sister Beth, when she travels, she takes a little urn, that urn's about 3 inches tall, with her son's ashes. She leaves the main urn on the mantle, but she likes to have Randy with her. So she snuck Randy in her pocket up to the testimony stand, and she said, jail is too good for these guys. And she basically, told them off. But on her way down from the witness stand, she pulled out her urn and she shook it at them. And she said, this is your drug, and this is what it did to my son. A reporter sitting in the front row said he thought she was going to throw it at them. She actually came to my event in Roanoke. We had the first book launch event was at the Taubman Museum of Art, which has a beautiful collection of the photographs in the book taken by my friend Josh Meltzer. Her husband had just died 10 days earlier, and it was his dying wish that their niece drive her up to Roanoke to be there for the event, which was so moving to me. And she brought her son, Jesse James is his name, and he was somebody she had fostered a lot of kids who were orphans of the opioid crisis, and she ended up adopting him. She's in her 70s, and she's got this little 10-year-old boy named Jesse James, and he's a Spitfire. In Roanoke, where I live, by the time OxyContin was reformulated and the pills grew increasingly hard to get, many teenagers and 20-somethings were already hooked, and the drug dealers stepped in to fill the demand, knowing that the fear of becoming dopesick portended one hell of a business model. This is Tess Henry. She's the daughter of a Roanoke surgeon. Her mom is a hospital nurse. I began following her story in late 2015. I don't think I'd even written the book proposal yet then. A friend of mine had rescued her dog and returned her dog to her house where she was living with her mother, but it wasn't going very well. And the mother said she had to go to work, she's a hospital nurse, and she didn't want to leave her heroin-addicted daughter at home alone with her newborn baby. And my friend Elizabeth said, just to show you how, this crisis, there's no neighborhood it isn't. This is a family that had a second home on Bald Head Island, North Carolina. My friend Beth is may be doing a book on heroin. Would you guys talk to her? And they said yes, because people will have no idea how hard it has been for us, educated people with insurance, with resources, to get treatment. And sure enough, they were right. She had been overprescribed opioids, 2 30-day prescriptions for a simple case of bronchitis at an urgent care center in 2012. I said, how did you know you were hooked? She was a waitress at the time, had dropped out of college not long before. She had been a French major at Virginia Tech. How did you know you were hooked? She said, I Googled my symptoms. And I said, holy crap, I'm addicted. One of her waitress friends, she worked at this really fine restaurant in Roanoke called River and Rail. One of her waitress co-workers was dating a drug dealer. She started buying pills from him, and then when the pills got harder to get, he introduced her to heroin, and then she just crushed them up, and it looked exactly like the pills crushed up. And then when that no longer kept her from being dope sick, she went to injecting. She wrote, I was in love. After 3 shots, I was in love. She wound up arrested for stealing a plumbing implement from Lowe's, which she planned to pawn for drug money, whereupon she learned when they took her to jail, a jailer came by, offered her a little cup of Tylenol with codeine. Tess didn't know she was 5 months pregnant. The codeine was to help her baby not go into withdrawal. So I met her shortly after she gave birth, and I watched as she bounced from rehab to outpatient program to losing custody of her son, and then became homeless. Her mother and some well-meaning recovery advocates sent her to an abstinence-only rehab in Las Vegas. Shortly after this picture was taken, Tess would come home periodically off the streets, and she would say, I'm gonna get better, I'm gonna get my son back, I really wanna be clean. But you see, she's got the abscess on her arm here. She did all the shopping for Thanksgiving dinner. She did all the cooking for Thanksgiving dinner for her whole extended family. And the only person that thanked her was her mother. Her siblings just could not understand how it was that she couldn't be a better person and just not do these drugs. Her family was pro-NA and AA, and they were anti-maintenance. An older relative had done well with her alcoholism, with AA, and had 6 years sober. So when they sent her to this abstinence-only rehab in Las Vegas, it was like most rehabs in America, didn't allow people to be on MAT, medication-assisted treatment. Tess herself believed it was her best chance at surviving, to go all the way on the other side of the country. As she wrote in her journal at the time, I need to be admitted because I'm going to die if I keep living the way I am. I've never kept more than a month clean time since spiraling out of control. I know I won't get my son back unless I make a big life change. I want to better my life so badly and become the person I was before drugs and the person I know I can be. So she had been on and off MAT for short periods, but her doctors at the time, this is 2016, were accepting cash only, and most had long waiting lists. When they drug tested her and found out that she had relapsed with marijuana, they cut her off rather than increase her dosage, which sent her back to heroin. Tess checked herself out of the Las Vegas rehab last spring. It was Mother's Day, actually. And she was homeless on the streets for most of last year. We found out later she had been sleeping in the corners of casinos, in a trailer of a known pimp and drug dealer, in an abandoned minivan. She was dealing drugs too, as she had been all along. She told me, she called it middlemaning. She would deal in order to fund her own supply. Not high up, it's what most users do, actually. So when you hear politicians talk about executing drug dealers, think about who most of the country's drug dealers are. Most are addicted users who are selling to support their own habit. Many get arrested and turned into confidential informants, forced to squeal on their sources in exchange for what prosecutors call substantial assistance or a lower sentence. It's an ethically fraught, in my opinion, and completely untransparent system, and yet so many of our kids are getting caught up in this. Most of the drug dealers in my book are tree trimmers, they're former high school soccer, basketball stars, Tess was a really fast guard, her coach told me. There are people like Jesse Balstridge. He was a burly high school football star whose mother had him buried at the edge of the Strasburg Cemetery, right next to the football field where he had once made the crowds roar. And you can see it, the lights in the back of the picture. So the high school's right next to the cemetery. The mother has him buried right at the edge. And on his headstone on the other side is number 55, which was his football number. So at the same time I was following Tess and the rest of the Hidden Valley crowd, I was also trying to get a handle on the criminal justice side, what the effects of the war on drugs were in communities. I met Christy for the first time at Jesse's gravesite, and my license plate just happens to contain the number 55. And I noticed mothers do this. I noticed so many mothers, they find a connection. One of the mothers, I gardened, she brought me sunflower seeds because that was her son's favorite flower. And then now we text each other pictures of sunflower seeds. With Christy, I was okay. I was Jesse sanctioned and Jesse approved because the number 55 was on my license plate. And at the time, Christy just couldn't figure out how it was her only son, who was just charismatic as could be. He never missed a day of work. He worked construction with his dad. How did he end up dead of a heroin overdose on someone else's bathroom floor? She's told me over and over, I thought it was just pills. So she asked me to find out basically what happened to my son. She said, if I can learn that, then I can help educate people and hopefully prevent it from happening. And it was just this really sweet moment. We're at her gravesite, and she wanted me to find out as much as I could about Jesse's death. So the book actually begins with me going to visit the twice convicted drug dealer in prison who landed in this tiny farm town where they lived and set about, according to police, turning a handful of known heroin users into hundreds almost overnight. And it's a really interesting story. It was much more nuanced than the police made it out to be. It says a lot about the war on drugs, in particular in minority communities, and I felt, of course, it was my obligation, just as I gave the police officers that prosecuted Ronnie Jones, also to let him tell his story too. The morning a Woodstock police officer found Jesse dead, he answered the young man's ringing cell phone. It was on the vanity right next to where he lay on the floor of the bathroom of his friend's house. And the phone rang, and Sergeant Lutz answered the phone, and it was an abstinence-only rehab center in Florida saying, we have a bed again, you can come back. So it's a grim story. We now have 2.6 million Americans addicted to opioids. Some experts think it's as many as 4 million. But as story after story shows, playing drug dealer whack-a-mole isn't making the problem go away. If we arrested every Ronnie Jones operating today, we would still have 2.6 million or 4 million people addicted to opioids. So I'm a journalist, I'm not a public health expert, but what do we do about this? I felt like my job was I had to impose some sort of order and hope on this problem, on a chaotic problem, right? It's a really complicated problem. So I have some thoughts. I'm going to close with them and then I'll take questions. I followed a program called the Hope Initiative, which was based on Gloucester Mass program, where the police chief there said, we're going to divert people from jail and into treatment. But unlike Massachusetts, which the Affordable Care Act was based on Romney Care, they had Medicaid expansion, and they also have any facility there accepting Medicaid or Medicare or TRICARE has to allow people that are coming for treatment to be on MAT by law. Virginia, at the time I was following the story, none of those things applied. So what ended up happening is people would come in to this free clinic for the working poor where largely volunteer women, many of whom had lost their children, to opioid overdose, were helping sort of triage them. And they had social workers on hand to help them get hepatitis C testing and things like that. And they made this big chart of all the places they could send people to. Only 2 rehab centers in Virginia at the time accepted people on MAT. So what I watched happen over and over is that people who were on buprenorphine or methadone would lose their access to it, and then they would end up relapsing, and many of them dying. This is 28-year-old Joey Gilbert. She was Tess's best friend. I have text message exchanges from them in the book. They were couch surfing together, sort of helping each other out when they were both homeless. And she had been on her father's insurance and had been on MAT successfully for a number of years before she turned 26 and lost her access to insurance. A Hope Initiative volunteer found her a treatment bed at an abstinence-only rehab in Charlotte. The catch was she had to be completely drug-free upon entry, so no more buprenorphine for Joey. She started cutting her pills in half, weaning herself, even though her friends, her doctor, everybody was saying, don't do it. She relapsed and she died. Her family firmly believed she'd be alive today if she'd had access to Medicaid health insurance and a clear path forward for continuing her MAT. This is a photo of her on top of her box of ashes that her parents keep in front of the plate glass window overlooking Hidden Valley. In Virginia and elsewhere, we are largely leaving it to volunteers to deal with the worst drug epidemic in the history of our nation. I think it's a national disgrace. We're relying on Battle of Dunkirk strategies, leaving the fight to well-meaning people in their fishing vessels and private boats when what's really needed is a full-on Normandy invasion. This is Dr. David Hartman on right. He was the first blind physician in the country in modern times, as well as the first Roanoke Valley doctor to get waivered to prescribe Suboxone. This is his wife, Sherry. She's a psychologist. I've known him for many years. They run an outpatient clinic in Carilion, which is the nonprofit hospital system in Roanoke, where they've convinced the system to donate more charity care dollars for addicted people who don't have Medicaid. Of course, Virginia did just pass Medicaid. It has not quite yet trickled down. That was good. But where the wait to get into their program is 3 weeks long. And if you overdose and you end up at the Carilion ER, you will be given a sheet of AA and NA meetings, and you'll be given the Hartman's number, but they won't be able to see you for 3 weeks. I write about the Community Service Board was beginning to expand MAT just as I was finishing up the book early this year, but there still wasn't a smooth handoff from MAT for detox patients. And so when Tess's mom called, because she wanted to get Tess home from Las Vegas and get her back into a program, the Community Service Board at the time would only see her if she was a pregnant mom. Everywhere this girl went, I'm telling you, bureaucratic barrier after barrier. When she's got a hospital nurse, a granddad standing by ready to write another check, she cannot get the treatment she needs. And there are thousands more people just like her in the Roanoke Valley alone that need to be reached. Not long ago, police arrested a student at our community college selling Xanax bars in the parking lot, but it was really fentanyl that he had mail ordered over the dark web, fentanyl bars. So people don't have that 8 years that the Harvard expert was talking about in the era of fentanyl. This is Vinny Dabney. He helped me a lot with the book. He leads an NA support group, and he leads a Suboxone support group. He is one of the rare people that is pro-MAT and pro-NA, and that I could find in Roanoke anyways. He was a 30-year heroin snorter and had kicked it only after he got arrested and was sent to a very intensive drug court program that no longer exists. It was a residential program that no longer exists because of lack of funding. I used to take Tess to Vinny's meetings, and when I would take the baby and her, we agreed that we would meet once a week. She had to go to the meetings in order to keep getting her Suboxone. She had to take a little sign-up sheet back to her doctor, who accepted cash only, by the way, $100 a week. And so Vinny would sign off, and I would walk the baby around the back when he got fussy. And with Tess's permission, I would record our interviews as I drove on my phone. But when Tess asked people to sponsor her at these meetings, they all declined when they learned that she was taking buprenorphine because they considered her unclean. You're just substituting one drug with another. I believe that attitude is the #1 barrier to turning back the opioid crisis. Most drug courts in Virginia's coalfields don't allow MAT. Judge Hurley is the exception. He told me his best evidence was that he had 13 mothers last year deliver babies and not one of them had NAS, and you can't put a price on that. Judge Moore in Russell County, a great guy. I watched his hair turn from salt and pepper to white in the course of 18 months that I was following him, and just a great guy. His prosecutor was against it, and finally I'm told they're now allowing Vivitrol shots, which is expensive, only lasts a month, but it's a start. Got to pry open those hearts and minds. People come up to Judge Moore in the grocery store and beg him to put their children into drug court when they don't even have any charges. And of course he can't do that. And then at the end of the book, Judge Moore, who I'm interviewing for the 5th or 6th time, says, Beth, tell me something I can feel hopeful about. And he jokes, he says, maybe when I read your book, we'll know what to do. And he laughs, but he's closer to tears than laughter, and I can tell. So I tell him about Bob Garrett and his program over his program to get people jobs and housing. And I tell him about these guys, Rob Pack and Dr. Steve Lloyd, who's in recovery himself for how many years? 14 years, yeah. I kept interviewing Rob. He said, you gotta call Steve, you gotta call Steve. I was like, I don't have time to call one more person. And then I was like, thank God I called Steve. Yeah, I know. So they organized this working group that really needs a sexier title than the working group. They collaborated to bring in millions in grants for both treatment and research. And as I learned from other places that had initiated harm reduction measures in their communities and treatment centers in communities that didn't want, not in my backyard treatment centers, they really had to be willing to get their butts kicked in meeting after meeting, not just here, but also in progressive Boston, where a homeless shelter director, a doctor, talked people into letting her have a place in her facility where she was already operating an M18 clinic where people could come in and be medically monitored as they rode out their highs. She said, I'm stepping over them on the way to work. They're already here, let's just bring them inside. The choice is, otherwise they're just gonna die. I'm already stepping on them. They're dead bodies on the way to work. So the working group wanted to you all are probably familiar with this story, but they wanted to open a treatment center, mainly dispensing methadone in Gray, Tennessee, which is a rural, pretty conservative community. And the response was not happy. I think in a village of 3,000 people, about 2,000 people signed a petition against it. They marched. They held signs. They called Rob and Steve ETSU drug lords. Their children held signs. And so I told the judge the story about what Steve, Dr. Lloyd, said to one of them. They were intimidating him. They filmed him as he spoke in one of these community center meetings. And he said, I looked out and I could see 4 church steeples in the distance. And I had gone to church and played ball with most of the people in the room. And one woman shouts out, put it in your neighborhood. And another one says, how many chances are we supposed to give these people? And the same week, a sheriff in Ohio had just said, we're going to take all the Narcan away from our deputies because they're sucking the taxpayers dry. Narcan after Narcan in the same person. And Steve thought about that. And he thought about the disciple who asked Jesus, how many times should a sinner be forgiven? Should he be forgiven 70 times? Or should he be given 7 times? And so Steve said to her, how many times should we bring these people back to life? 70 times 7 is meant, and I'm not a Bible quoter, let me just tell you. But that quote nails it. It nails everything that's wrong with the way we view addiction. Thank you, Jesus. We need to get out of our silos. One of the things I love that Steve said, the problem is it's not that people aren't trying, but there's no coordination between groups, and everybody views the problem through the lens of how they get paid. So the criminal justice system doesn't want to give all that money they're getting from the war on drugs, even though in Portugal, when they decriminalized, put the money toward that, overdoses went way down. So one of the problems, I think, is we have an observation bias. We see criminal justice folks only see that when it's not working. Drug court judges only see problems with it. I have a friend of mine who's a judge in Patrick County. He said, Beth, if I let people take Suboxone, they would just trade it for methamphetamine. And I said, Martin, you're only seeing the worst side. You're not seeing people like Van Z's patients who are getting their kids back. They're getting their jobs back. Some of them are getting off disability. And guess what? Those people didn't even want to be quoted in my book because of the stigma against them in this world, because of the way Tess was treated at her NA meeting. This is a young man I interviewed. I wasn't sure if I was going to use him in the book. He's the town maintenance guy for Big Stone Gap. And I was listening to my interview with him not long ago. I record all my interviews. And he's got these sparkly brown eyes. And I stopped in the middle. I said, you are so freaking smart. Just one of these guys like Jesse. When Jesse used to, the other Jesse, when he used to take walks in his neighborhood, the neighborhood cats would follow him. He was just like one of these people. Everyone loved him. And he had been addicted to opioid pills. At the time I interviewed him, he was not taking MAT. He said he didn't believe in it, but he was smoking a little weed. And it was all right with his wife, who made sure all he was doing was smoking a little bit of weed. And she drug tested him to make sure he was only smoking a little bit of weed. And so about a week after I interviewed him, I got a call from a mutual person that had introduced me to him. His wife had told him, if you relapse again, I will leave you. And as he had told me in our interview on tape, if she ever finds out she don't need me, I'm screwed. He relapsed, he went into the woods, and he shot and killed himself. There are people in my book who died before I had a chance to type up my interview notes with them. So lastly, I'm going to tell you Tess's story. Her mother was moving mountains before Christmas to get her home. She was living homeless on the street. She had lost her ID. Her mother somehow got the Virginia DMV to issue an ID without the person there. I mean, that alone in itself deserves a medal. And then she didn't have anywhere to send it because Tess is homeless and you don't get an address if you're homeless. So then she asked a friend, okay, we've got that sorted out. And then all of a sudden she disappeared. On December 23rd, she texted her mom, I just got on Suboxone. Somehow, we don't know how, we know she was prostituting, probably with her money from prostitution. She had gone to a doctor and gotten on Suboxone. So I get a call the day after Christmas, and it's the call I thought I would get. I thought I would get a call saying that Tess was dead, and I got that call. But I thought I would get the call saying that she was dead from an overdose. And she had actually been murdered. On Christmas Eve, her body was discovered in the bottom of a dumpster near a homeless encampment in Las Vegas by another homeless addicted man who was foraging for cans. We've got to do better. We've got to be more systematic. These families are really worn out. Families and first responders. People are worn out. They're riven over treatment ideologies. The week of Tess's funeral, I watched her family entirely divided about her bad choices she had made, completely overlooking the fact that her brain had been hijacked by this drug. And over the course of so many years, she had been denied life-saving treatments. Steve wrote me a note after he finished the book a week or two ago. And I think it's the best response I've gotten. He said, there was a person in the book that said he couldn't wait to read it so he would know the answer to the opioid issue. Well, I think you found it, but it's not an answer that anyone will like a whole lot. It's community. Arguments will rage on between abstinence and MAT, as well as law enforcement and treatment facilities, legitimate and not. And politicians and lawyers will have their 2 cents worth. But the truth is that it's about Tess and her family and how we as a community of human beings can provide the environment for each other to thrive, as well as to recover from sometimes unspeakable hurts. And he signed it 70 times 70. 70 times 7. So lastly, I'm going to show you the necklace that Tess's mom gave me after Tess's, about a month after Tess's funeral. It's got a poem, Tess's favorite poem that represented the way she felt about her son. It's an E.E. Cummings poem called I Carry Your Heart in My Heart. She really wanted to get back and get custody of her son again, who she loved more than anything in the world. So it's a picture of her with the rescue dogs. It's that picture. And then I keep James Baldwin on the other side, because everybody should have James Baldwin in a locket around their neck. James Baldwin said, not everything that is faced can be changed, but nothing can be changed until it's faced. And I found this quote by James Baldwin just the other day, so I'm going to start adding this to my repertoire of James Baldwinisms. I don't believe any longer that we can afford to say it is entirely out of our hands. We made the world we're living in, and we have to make it over. Thank you.
Fantastic, thank you very much. We'll have time for a few questions. Just a reminder, there'll be a book signing afterwards, and I know Beth will be willing to answer additional questions at that time.
Hi, Ms. Macy. Thank you for coming to our area. And I just wanted to let you know that I heard you yesterday on the Majority Report. If you listen to that show, if you go to the end of it, I heard you mention a particular doctor. Sorry. I called in to Sam Cedar, the host. He took my call, and I said, I bet you I know who that doctor was, knowing that it was Dr. Lloyd, who helped me greatly. And so I just thought that was too much of a coincidence to let go. Just a genuinely hot mic. But Dr. Lloyd's an amazing guy. Helped me. I kind of feel like I was patient zero. I got put on pills at the University of Tennessee with no prior drug use in 2001. And it took its toll, about a 12-year journey. So is there, are we coming towards the end of this? And is there a more dangerous, I see a lot of methamphetamine creeping in. This is because now that the pain pill side is going away, I see a lot of these folks creeping into the methamphetamine. So this could be phase 2. Thanks again. Love your interview. Suggest the Majority Report from yesterday. It's on YouTube and podcasts. So wonderful.
And Dr. Still here? Am I saying that? Smith-Smythe. Yeah, a lot of people using meth as the drug court judge was worried about, because it's really really skyrocketing in our communities. And Tess's mother and I did some follow-up reporting in Las Vegas, and spent a week living among the homeless where Tess had lived, trying to find answers to what happened to her daughter, and also trying to find some closure. And the people out there who were addicted, a lot of them were using meth at the same time. Some of them told us, because they live in these little homeless encampments underneath the city in these drainage ditches called the Wash. They were using meth in order to stay up all night so nobody would steal their stuff. It just heartbreaking. And in terms of the trajectory, I believe it was Don Burke said, still sometime after 2020 when we're going to see a plateau. We don't really know. We did see 3 states start to have downturn in overdose deaths, and these states were in early Medicaid expansion states. So I know I saw on your paper today, you're still debating that here. So let's everybody get people out to vote. But those states are Rhode Island, Vermont, and Massachusetts. Those are states that have harm reduction programs and MAT protocols in place from the ER, hub and spoke model. Maybe one other question, and I can repeat it so you don't have to talk in that awful mic.
Beth, in the past you alluded to there being some correlation between Ritalin and opioids. Could you elaborate on that a little bit?
Sure. What I say in the book was, or I don't know if I say this in the book, but I just noticed that a lot of the stories I was collecting, like Stridge, the football player, many of them, once I'm collecting their story from their family after their death, they're telling me the person's journey about how they got addicted, and I just happened to notice that so many of them had been on Ritalin. And Jesse, for instance, had been on Ritalin since I think he was 7 or 8, and he was kind of a hyperactive kid, and the teacher had begged the mom was resisted, and it seemed to quell his hyperactivity and his behavior was better. But when he became a teenager, he had some sports injuries, was prescribed opioids for snowboarding and football injuries. She doesn't know exactly which injury started it, but he became addicted to Roxycodone was his pill of choice. And he started trading his Ritalin for other people's pills that they would pilfer from their parents or get prescribed to them or the grandparents. And I just noticed it became currency. And I asked my sons who were in college, oh yeah, the Ritalin is off the hook. The people are taking it to stay up all night studying, sure. They're also taking it to stay up all night drinking. And they're trading it. 2/3 of our college seniors have been offered stimulants not prescribed to them. So the science is unclear. Thank you for asking that question. I found some research suggests, we know it's overdiagnosed, but there is research out there that suggests that untreated ADHD can also lead to risk-taking behaviors. Do either of you want to address that question?
I think that's dead on.
Okay.
The thing I see, Beth, is that the symptoms of ADD closely resemble the symptoms of chronic trauma. And I know you already know this, but if you look at the roots of addiction, a lot of it is buried in childhood trauma, ACE study, and those type of things. So that's the context that I see Ritalin and drugs like that used right now, because it's much easier to write a prescription for a pill than it is to deal with the chronic trauma.
Yeah. Yep. Question in the back? Do we want to do one more? Or? Okay, one more question. Yeah. You can just holler it out and I'll repeat it.
This is an official document by the state of Tennessee that was just put out recently from the medical examiner for the state of Tennessee.
Yeah.
From the medical examiner's perspective, abstinence should be at the forefront of treatment. As with Alcoholics Anonymous, people should strive to be free from the addiction. Expecting to be saved by naloxone after each overdose or taking an addiction-fighting drug, such as methadone or Suboxone, is not the answer. Methadone and Suboxone, if used, should be only for a short duration. However, we see these drugs being utilized as bridges between drug use. That is the opinion of the state of Tennessee, who has consistently tried to shut down MAT clinics in the state of Tennessee. I'm a board-certified addiction medicine specialist, and I've never seen anything like this in any other field of medicine.
Thank you for that comment. So what's the answer to that? We've got to get more doctors. We've got to get more people voting. We've got to interview all of our candidates. about whether they believe in drug courts, whether they believe in drug courts that allow MAT, what's their Commonwealth's attorneys or prosecutors' stance on this. I mean, that determines a lot at the grassroots level. We have a police chief in Roanoke, where I live, who's come out against the syringe exchange and recovery program because he thinks that's just enabling users. He hasn't been to any. So he hasn't seen, like I have, people getting tested for hepatitis C, which is going to be our next tsunami. He hasn't seen people being referred to treatment and exchanging clean needles, dirty needles for clean ones at a one-to-one level. I've got friends whose kids are stepping on heroin needles while they're walking to school. And I mean, the answer is we've all got to be talking to our public officials. I had a meeting with the city manager last week and the vice mayor to talk about how we're going to get our police chief on board with this. The city council is 7-0 in favor of it. So I'm hopeful, like we're starting to see little incremental changes, and we need to be heralding these states that are seeing reductions in their overdose deaths because they're doing the right things. And we've just got to stand up to this attitude that people don't deserve medical treatment for their opioid use disorder. Too often, we're sitting in the pews of the church at their funeral before we even consider them human beings worthy of treatment. Thank you.
So I'm going to use this microphone as well to thank Beth for that magnificent presentation. And we do, being a good Southern institution, we have some parting gifts.
All right. Aww.
Of course, we have branded material that you have to use on your next trip. But more importantly, we're really pleased to bestow upon you the honor of honorary professor in the College of Public Health.
Thanks. Thank you so much. I think that means I get to call Rob anytime I have a question at all.